Welcome to the True Health Talk Show with Dr. Brian Wickstrom. Dr. Wickstrom is a health and wellness professional whose mission is to help people understand and express the perfection that is within by sharing secrets on how to truly live a healthy, holistic lifestyle. Now here is Dr. Wickstrom.
All right, well, hello everybody. Thanks for joining us here today. This is the True Health Talk radio show, and I'm your host, Dr. Brian Wickstrom. I'm a chiropractor here in the Spokane Valley area. And if this is your first time listening to our show today, what we're all about and our mission and purpose on the show is really kind of demystifying the myths out there. We're really bringing you guys the facts and all about health and healing and wellness, because there's so many things that are out there right now that it's really frustrating for people to really know who to believe, what to do. And so we really want to make your job easier to help you change your life, change your health, and really get that movement in the right direction. And so what we're continuing our series all about here today is we're talking about heart health, okay? And so if you listened to our last show, we talked about heart disease. And just really quickly, some of the statistics here right now in the U.S., we're not doing good, okay? So heart disease, year after year after year, it's the number one cause of death from disease. It's estimated that 1 out of 2 Americans will be diagnosed with this illness at some point during their life. And every year kills right around 800,000 people every single year. And about every 43 seconds, somebody has a heart attack. And so 63% of the women that have a heart attack and 48% of the men that have a heart attack have no prior symptoms. So basically they have no warning signs whatsoever that this problem's even going on, and boom, they have a heart attack. Okay, and so even the looking at the cost factor, so right now here in America, medical bills, number one cause of bankruptcy in the U.S., and so just a less severe heart attack over about 20 years, it's estimated can cost up to about $760,000 with hospital stays, medications, doctors' follow-ups, surgeries, things like that. And so that's equivalent to about $38,000 a year just on this illness. And so the good news is that this problem is preventable and your body can heal from it. And that's really what we're going to start to dive into here on these upcoming shows over the next several weeks. And so I want to start out today really just by sharing a quick quote here. This is by Soren Kierkegaard. And what he said was that there's 2 ways to be fooled. The first is to believe what isn't true, and the other is to refuse to believe what is true. And that's what we're all about here on the program is helping you guys see through what isn't true and really get the facts and understand what is the truth out there. And that's why we call it the True Health Talk radio show. So let's go ahead and jump right in. So today we're going to be kind of focused more on blood pressure. And so first off, let's talk about blood pressure, what the numbers mean and all that. So the normal blood pressure, so you have your systolic, which is the top number. That's the pressure when your heart is actually beating. And then the bottom number is the diastolic. And so that's the pressure when your heart is actually resting. So the normal blood pressure is 120 over 80, systolic over diastolic. And so there's so much emphasis in our medical system all about blood pressure. Every time you go in for any kind of physical or health checkup, they're always looking at your blood pressure. But is blood pressure really the bad guy? Did your body just forget how to regulate your physiology? And so here's what you need to understand. And so if you think about it, when you go into exercise at the gym or at home, what's happening to your blood pressure? It's going up. Okay, if you're out in hunting in the woods and you run into a bear or a moose, what's going to happen to your blood pressure? It's going to go up. If you're at home and you're taking a nap or you're going to bed for the evening, well, guess what's going to happen to your blood pressure? It starts to go down. So it's different situations in the environment that we're in. Our body actually regulates our blood pressure. It's not necessarily our genes. It's a physiological response. So short term, having higher blood pressure or lower blood pressure, that's part of your body's adaptation to the environment and the stressors that it's being encountered with. Where it can be a problem is that if it's over a long period of time, and so when people have chronic long-term stress or chronic long-term poor lifestyle choices and decisions, that's where it really becomes a problem, because long-term higher blood pressure, it does damage the arteries. It can lead to vision problems, heart failure, heart attacks, affects your brain or kidney function as well. And so traditionally, when people go in for their annual checkup and they find out that their blood pressure is creeping up, because a lot of times you don't know that that's actually happening, because that's why the other name for high blood pressure is a silent killer, because you don't feel it until somebody tells that you have it generally, or it's been there for a long, long, long time. But generally what happens when you go in and somebody tells you that you have high blood pressure is that you're being written a prescription for some sort of medication to lower that down. Okay, I want to talk about here, are those things effective? Are there side effects that come along with them? And you might be surprised. So one study here, right, this is out of the Journal of American Medical Association of Internal Medicine from 2013. And they found that long-term use of calcium channel blockers, which is a variety of some of the medications that people are given to lower their blood pressure, in particular with breast cancer, increases the risk for breast cancer. So yes, your blood pressure might be a little bit lower, but actually it's increasing your risk of other problems like breast cancer. So another one actually looked at 45,000 patients. This is again out of Journal of American Medical Association. And they found that patients with a history of cardiovascular disease, there was no difference in mortality rates between the medication group and the non-medication group. And so basically, a lot of times these medications aren't making a difference. Yes, they may lower your symptoms a little bit of the high blood pressure, but are you increasing your risk of other problems down the road that are maybe more severe? Or is it even really helping you whatsoever at all? Another thing a lot of times that people are given to prevent heart attacks is aspirin. And this is just crazy right here. I was actually just looking on the FDA website not too long ago. I did a newsletter all about aspirin a day to prevent a heart attack. And even the FDA admits right on their website that's 0% effective at preventing heart attack fatalities, especially in people that have no prior history of a heart attack risk or stroke. But yet it increases the risk of GI, gastrointestinal bleeding, ulcers, and also has been shown it can increase the risk of breast cancer, especially with women. And so that's just crazy what's going on out there. And so one of the things that Hitler said back in the day is he said, if you tell a lie big enough and frequently enough, then eventually people are going to believe it. And I feel that that's kind of what's happened with a lot of these myths that are out there surrounding heart health and heart disease, is that we've just been told that these lies for so long, and we just believed it. Even the doctors believe it. They're not bad people and trying to intentionally harm people. I don't believe that that's the case. Okay, they're good people. They're doing the best with the knowledge that they actually have. But the problem is that if they took the time to actually look into the research, then they might actually change their approach and their opinion. But that's really what we want you guys to understand here. So I had a patient that came in. He is one of our oldest patients in our office. He's 93 years old. Okay, and so came in. He's had several heart surgeries in the past. He's on 5 medications, and he's also diabetic as well. And so here he was. I mean, he was coming in, and a lot of times people, once they start to get up there in years, they think of what's the point, or why make these changes, or they just don't want to put in the effort. But here he is. He's as sharp as a tack. He did have some of these health problems like I talked about, and so we started to work with him, get his spine checked and adjusted to help improve his nervous system. And we worked with him, and his wife was also coming in as far as changing some of their lifestyle, eating better, moving their bodies. And over just a short period of time, he was actually off almost all 5 of the medications he was taking. One of them, he really reduced the dosage, but wasn't able to completely get off it yet, and lost over 20 pounds. And so that's the thing, is that a lot of you don't even really know what your potential is. And so here this guy is, 93 years old, still going, still making changes, and sharp as a tack, and walking, and really just maximizing his experience here on this planet. And I just think that that's so awesome. And so what we want to do here on this show is we always want to give you guys an opportunity. If you're out there right now, sick and frustrated, maybe you're getting the runaround from health providers that you're seeing in the past. Maybe you're sick of being on these medications and not actually getting any answers. or maybe you're just sick of being in pain every day and tired and want to make some changes. And so we've opened up 3 spots actually for the top 3 callers to come in, and we're going to help you get some answers. We're going to help you get down to the cause of what's going on with your health. And the first place to start is by checking your spine and nerve system. And the reason I say is because your spine and nerve system is what's controlling and coordinating everything that's happening in your body all throughout the day. If you have misalignments in your spine or poor posture, that can actually influence how your nervous system's working and cause a lot of these health problems that you're dealing with. And so oftentimes this is the key thing that is overlooked. People don't have their spine and nerve system checked, and we want to give you an opportunity to do that. So what that looks like is you come in, we're going to do a history, we'll do an exam, we'll do a scan on your spine, which detects areas of nerve irritation, inflammation. And then based off what we find there, we're going to do some digital x-rays. And that way we can see how long your problem's been there, what we're going to need to do as far as correction goes and exercises. And we'll sit down and go over all the findings with you and recommend what I would suggest moving forward there. And it's going to be awesome. And so usually that's over $200 to do that if you're just to call in or walk in the door. But if you're one of the top 3 callers on the show today, we're going to give you a chance to do that just for $50. So what you need to do is pick up the phone, give us a call, and leave us a message, and we'll get back in touch with you. So the number to call is 509-241-3088. Again, 509-241-3088, and leave us a message, and we'll get back in touch with you. So we had a patient came in. Her name's Juanita, and for years and years, both her and her husband, who was struggling with Parkinson's, which we're helping him out with as well, came in, but she was overweight. She had just terrible chronic neck pain, high cholesterol, high blood pressure. She's on diabetes medications, and really didn't know what to do. I mean, she just thought that that was something that she's gonna have to deal with for the rest of her life. Here, take these pills. And really, we love empowering our patients, helping you get control your health and take responsibility for that. And that's exactly what we did with her. So first off, we started by adjusting and correcting her spine. She had misalignments. She had lost a curve in her neck. She had some scoliosis actually going on in her lower back as well. So we started working on that, getting those adjustments in and correcting her spine. And we started to coach her on how to make some improvements with her lifestyle. And so literally in just over about 4 or 5 months, she'd lost about 15 pounds. She was off the medications for her cholesterol, her blood pressure, her diabetes and her blood sugar levels were doing tremendously better. And so those are the kind of changes that we love to see, just people just totally turning their health around. And we want to give you an opportunity, if you're out there right now wanting to make some changes, and you want to get your health back here in 2018. Well, we've opened up 3 spots for the top 3 callers to come in, and we're going to give you a chance to do that and get some answers. So the number to call is 509-241-3088. Again, 509-241-3088, and that's for your opportunity to come in for a $50 spine and nerve system assessment. Get those answers that you're looking for, and we're going to help you take your health to the next level here this year. So if you're listening in here a little bit late, this is the True Health Talk radio show with Dr. Brian Wickstrom, and I'm a chiropractor here in the Spokane Valley area. And so what we're talking about on the show today is all about heart health, okay? And so we're continuing our series about this. And heart disease is the number one cause of death from disease here in the U.S. It's actually affecting about 1 out of 2 people. So 50% of people listening to this right now, at some point, if you're not doing the right things, will actually be diagnosed with this problem. But the good news is that it's preventable, and that's what we're talking about here on the show, is what you can do to make sure that you're on the positive side of those statistics and not ending up on drugs, having unnecessary surgeries, and going down a path that most people don't want to go down. And so specifically today we're talking about high blood pressure. And so high blood pressure, again, that isn't necessarily a bad thing. It's your body responding and adapting to the environment that it's in. And so if you're in some sort of stressful or dangerous situation, your blood pressure is going to go up. If you're resting and sleeping or meditating or something like that, doing breathing exercises, then it's actually going to work on bringing that down. So it's just part of our stress response. So it's our body doing the right thing at the right time for the right reason. And so what is actually responsible for your stress response is your sympathetic nervous system. And so the interesting thing is that 80% of heart attacks are preceded by low activity in the parasympathetic nervous system, which is the arrest and digest portion of your nervous system, and high sympathetic, which is your fight or flight. So high stress precedes the heart attacks, which makes sense. You think about certain situations that cause people to be thrown into having a heart attack where they lose their job, or they're in a fight with their spouse, or something like that. Those are situations that can kind of put people over the edge into having a heart attack. And so it's our nervous system in the balance between those two nervous systems, your sympathetic and parasympathetic nervous system, that is vital. And so interesting thing is that this information has been around for quite a few years. And in fact, back in the 20s, there was a research study done by Henry Windsor, who was he's a medical doctor, and this was published in the Medical Times, and he's out of I believe it was the University of Pennsylvania. But anyway, so he was looking at cadavers of some humans, some cats, and he found that 49 had curvatures or subluxations in their spine. And so the conclusion of the study, and the whole purpose of it basically, was to find out, is there some correlation with spinal misalignments or poor posture with a sickness and disease and problems in the organs. And so the conclusion of this study that happened, almost 100 years ago, basically, was that it was rare to find an organ diseased which was not supplied by the same sympathetic nerves as the vertebrae in the curvature. So basically, in a nutshell, what that means is that it was rare, in most cases, where the curvatures in the spine or the misalignments in the spine were the same nerves that actually went out and caused the disturbance in the sympathetic nervous system, which shut the organ down and caused disease. So again, going on, the organs affected by acute disease, while the deformed vertebrae proved the curvature preceded the disease. So it caused the vasomotor spasm, result in decreased blood supply to the organs. So basically what happens when you're in that stressful sympathetic dominant state, then your blood pressure is going to go up because your body constricts your blood vessels to get more oxygen and blood flow out to your muscles, so your muscles can have the energy to run and flee from the tiger or the stress that you're around. So that causes the muscles in your arteries to constrict, and that's gonna, if short term, again, that's good if you're trying to actually escape a bear or a moose. But when it's a chronic problem, then that's really where it's an issue, because it constricts that blood flow to the organs. So it's more concerned with getting the blood supply to the muscles so you can run away and flee, and it's going to shut off the blood supply to your digestive system, for example, because when you're in that fight or flight mode, your body doesn't really care about your immune system or your digestive system and digesting your lunch. It cares about saving your life and getting you away from that danger. And so this is the interesting thing is that this is information has been around for quite a while, and how important your nervous system is in actually regulating your blood pressure. But yet this is never actually checked when you go in for your annual physical. Do you have disturbances or imbalances in your nervous system that can be causing your high blood pressure? No, the solution is here. Always take this pill, or maybe try to change your diet a little bit or something like that. But it's never actually looking at your spine and nerve system to find out if that's the problem. And so one of the best things to be addressing, obviously, and doing to make sure that you do have balance in your nervous system, the only profession that really addresses this is seeing a corrective chiropractor. Okay, and so you might be wondering, well, what in the world does chiropractic have to do with your heart or high blood pressure? Well, what controls everything in your body, like we're just talking about there, is your nervous system. Okay, and so they actually did a study out of that was published in the Journal of Human Hypertension back in 2008. And what they found is that, and this is actually in a majority of the patients, I believe, in the study, had no prior symptoms of neck pain or back pain. But what they found is that realigning the top bone of the neck, which is called the atlas, and getting proper alignment in that top bone which is actually where your brainstem is, which is the very first part of your brain to be formed when your body's being created from two cells, because that's where it controls all your vital functions. The most important functions that are necessary for you to be alive are developed first there, like your blood pressure, your heart rate, your breathing centers. All those things are controlled right in that area of your brainstem. But anyways, realigning that top bone in the neck, the atlas, cut people's blood pressure more than 2 medications combined, and it lasted for a lot longer. It lasted for at least 6 months in the follow-up with this study. And so how cool is that by just realigning the spine and correcting the position of that very top vertebrae in your neck, it restores that balance to your nervous systems, that's actually where your parasympathetic part of your parasympathetic nervous system, your rest and digest, stems from that very upper part of your neck. So that restores more balance with your nervous system, so it actually can bring your blood pressure down. Whoa, isn't that amazing? So another study here in 1988 out of the Journal of Manipulative Physiologic Therapeutics showed that adjustments in your mid-back or your thoracic spine lowered blood pressure significantly. Well, that makes sense to me because the nerves that come off the middle part of the back actually go out to your heart, your lungs, amongst other organs as well. So if you have a misalignment in your spine in that particular area, well, that can affect the signals getting out to the heart right through there and cause sickness and disease, cause those organs to start to malfunction and shut down. And so it's very important to make sure that you have proper alignment through there. And so, really think about this, what is it actually worth to prevent a heart attack? And as we talked about, previously on other shows, that when it comes to heart health or blood pressure, we don't really feel these problems, okay? Blood pressure is called the silent killer. Actually, in the journal Circulation, they found that 43% of heart attacks are actually silent, okay? So you don't actually feel them coming on. You don't even really know that you're having one sometimes, but yet it increases your risk of dying from heart disease and all the complications threefold, and it increases your risk of all-cause mortality by 34%. And so the problem is that most people out there aren't really thinking about their spine and nerve system in relation to their overall heart health or just the overall health and well-being. And so the whole process with getting your spine and nerve system checked is so important. And in fact, it's probably the most important medical test that you can have done. And I say that because with the testing that we do in our office, we do a history, we do an exam, we actually do a thermography scan along your spine, which detects nerve irritation, inflammation. And the interesting thing with that is Hippocrates. So many of you know him as the father of modern medicine. So one of the things that he used to do back in the day is when people were sick, is he would actually spread clay on people to find out which areas dried faster, which were the areas that were warmer, and that gave him some direction as far as where the disease was or where the organs were that were malfunctioning. And so basically we actually have a device that we can run along your spine, and it measures just that. So your body's not designed to be out of balance in anything, especially temperature. And so it actually measures imbalances in temperature along your spine, so we can actually find out where there may be some nerve irritation, inflammation, and what organs are affected in those areas before you have a heart attack, before you have some sort of sickness and disease that starts to show up in those areas. And then we can also do digital x-rays. And so the x-rays are going to help us see how long this has been there, what exactly is going on, and then what we're going to need to do in terms of adjustments, exercises, and everything else to help you get this problem corrected, restore balance to your nervous system, and so you can get your blood pressure down. You can just make sure that your body is functioning at the highest optimal level. And so usually if you come in and have all of that testing done in our office, that's generally over $200 to do that, okay? And it's definitely worth it if it's going to help you, prevent a heart attack or not be on medications for the rest of your life, absolutely. But one of the things that we like to do on the show, just for all of our great listeners out there in Radio Land, is we want to give you guys an opportunity to come in. If you're one of the top 3 callers today on the show, a chance to come in just for $50, and that way you can take advantage of all that testing. Once we get all the information, we're going to have you come back and we'll sit down, discuss your findings with you, and then what I would recommend moving forward. And so the number to call to see if you can be in one of the top 3 callers is 509-241-3088. Again, 509-241-3088. Go ahead and just call that number. Leave us a message. We'll get back in touch with you as soon as we can to help you set that up. And so one of the things that we talk about on the show, and I want to share a quick story here before we wrap things up, is I had a patient here that came in, and she's actually a nurse, and she'd been a nurse for over 40 years, and she was under the impression that because her mom had high blood pressure, her mom's mom had high blood pressure, that was something that she's going to need to be on medications for the rest of her life. And so she came out to one of our seminar events. She was invited by another patient to come, and she heard this message of where true health and healing comes from. And one of the things that never really clicked for her with all the training, all the years working in the healthcare field, never once did she think about her importance of her spine and nerve system. And so she ended up coming in to get her spine checked out, and found out that she had severe damage in her neck, which are the nerves that go up to your heart. They also are where your blood pressure regulation centers are. And so we started to actually work on correcting the proper curve in her spine and in her neck, and just getting things working and functioning much better up through there. Also with making changes with some of her lifestyle habits as well. And literally in just 6 months, she was off all the blood pressure medications that she's on, and started to see other improvements in different areas, whether it be her digestion. She's more active now. She's lost over 40 pounds. And that never would have happened had she not come in and been able to take advantage of getting her spine and nerve system checked, because that's the number one place to start to begin if you're on a quest to actually get healthy here in 2018. So again, we've opened up those 3 spots. If you're one of the top 3 callers to come in for a full spine and nerve system assessment to find out where you're at, get some answers for $50. So go ahead and give us a call, 509-241-3088. And that's all the time we have. Thanks, guys. We'll talk to you soon.
You have been listening to the True Health Talk program with Dr. Brian Wickstrom, heard every Monday and Thursday at 12:30 and Saturday at 10 on KTW 630 AM and KTW 96.5 FM. For more information on how to improve your health or to request a consultation with Dr. Brian Wickstrom, you may visit www.rccspokanevalley.com.